Imagine a single mother living in a rural area with an autistic son. She regularly has to take off work and pull her child out of school to drive almost 2 hours to the closest child and adolescent psychiatrist. She's worried that the therapy isn't working, and she herself needs to talk to someone. She's at her wit's end. Imagine a veteran living with PTSD and a growing social anxiety. He knows he needs to talk to someone, but the only therapist in his area is a 30-something-year-old woman. What would she know about his problems? So he doesn't go. Imagine a young professional living in a new city. She's worried about her work, her relationships. She's stressed. She wants to talk to someone. She used to see a counselor when she was in college, but now she has no one to talk to, and so she drinks. All of these people, and actually 1 in 4 Americans, are suffering with what's called their behavioral health. So behavioral health is a more inclusive preferred term to mental health, and it includes everything from anxiety, depression, mood disorders, substance use, and beyond. Actually, 90% of people who are struggling with these sorts of issues don't get the care they need. 90%. And this seeps into every aspect of their lives. From a personal perspective, their physical health is affected, their sense of self, their relationships with others, and even at a societal level, when these people are unable to be members of society who are productive and who are in the workforce and not within the healthcare system, everyone suffers. But there's good news. 3/4 of people who get care have no symptoms after just 6 months of behavioral health treatment, whether that's therapy or medication or otherwise. So it works. There's options. Why aren't people getting it though? There are 2 major reasons. One is the issue of stigma. There's a huge stigma on getting access to behavioral health services. Maybe you grew up in a family or a culture where getting help was seen as something, as a weakness or something that you shouldn't do. For whatever reason, it's often swept under the rug. Your behavioral health services are seen as something totally different. Of getting treatment for depression versus a broken arm is seen as something totally different. The second major reason is access. Did you know that 96% of counties in the United States have a shortage of psychiatric prescribers, and that the average wait time to see a psychiatrist for the first time is months in most areas? Months. What if you can't wait that long? Many people end up not getting access to care at all. So because of these 2 issues, how do we fix it? How do we get people access to care? How do we reduce this stigma? So I work with a team in an industry called telebehavioral health. And what telebehavioral health means, it's behavioral health care services. It's meeting with a provider. It's getting access to care. It's getting assessment and treatment, but it's doing it through technology. It's doing it through real-time video conferencing with a provider. So traditionally, this telebehavioral health has been done primarily in institutions like hospitals and outpatient facilities and clinics where they need an additional psychiatrist or they need an additional behavioral health provider, but they can't have them there in person because of this issue of access, because of this huge shortage. So they use a telepsychiatrist who can work from their home location and see patients. Maybe they're in Colorado or Kansas or Michigan, back to back to back. So it's leveraging the existing workforce, the existing behavioral health providers in a whole new way, and it's working really well. So telebehavioral health has also moved beyond kind of this traditional institutional model into new areas and into new realms that are really, really exciting and really increasing access to care. For example, in-home telebehavioral health is a new option. It's a way for an individual who perhaps lives in a rural or underserved area to log on just using regular internet connection, shop for a provider that fits their needs, shop for a provider that has a schedule or an appointment open at a time that works for them, and then do the appointment entirely online. It's totally increasing access. Let's think back to those 3 individuals that I mentioned in the beginning of my talk. How would it transform their lives if they didn't have to travel to see a provider, if they had the agency and choice to select a provider that really fit their needs and wasn't just someone who was within a driving distance for them? And then the issue of stigma. What if you're someone who is embarrassed to get care? Well, now you can do it within the privacy of your own home. You can do it without having to wait in a waiting room, without having to have that stigma attached to seeking care. It's really opening up windows. And it's also extremely effective. There's now scores of research on the efficacy of telebehavioral health in nearly all populations and with all disorders. It's found to actually reduce some of the power dynamics between a provider and an individual, and they're more likely to open up more quickly and talk about problems and get to the root of their needs. There was a study done of over 100,000 users of telebehavioral health services actually that found it to be more effective and preferable to face-to-face in-person services, and it actually reduced hospitalization rates by 25% in those cases. So, telebehavioral health, it's extremely effective, it's convenient, it's adding all of this value to behavioral health services and making it more accessible. So why isn't it not ubiquitous? There's still a number of reasons, a number of things that need to change to make it commonplace. For one is the issue of people even knowing that it's out there. When I say what I do, when I say the words telehealth, I get a lot of faces still. I still have to explain that this is even an option and that this is an opportunity for people. The second major issue is that consumers and individuals are used to having care done to them. They're used to being told that, okay, here are your 5 options of providers that are within a driving distance. These are your only choices. Hope it works out. We need to create a populace of empowered consumers who are proactive in their behavioral health care, who have choice and agency of who they're seeing and when. The other major issue is kind of a regulatory standpoint. There's a lot of changes that need to happen to make this happen on a system-wide level. For example, the issue of licensure. Providers right now have trouble crossing state lines and delivering care in another state. Whether they're a provider who's in Florida and seeing a patient in California, there's licensure issues there that need to be worked out. The second big thing is kind of standards of care. This is a slightly different form of care, and we need to make sure it's being done appropriately, that patients are using secure HIPAA-compliant platforms, and that providers are trained in best practices for telebehavioral health. And then the last issue is the issue of payment. There has to be reimbursement for this from payers. There has to be a way for this to be paid for the same way as in-person services. And it's moving in the right direction, but there's still a long way to go. So final takeaways from this discussion is, 1, if you or someone you know is struggling with your behavioral health, please get help. Let's get rid of the stigma. Let's talk about care. Let's normalize treatments, whether it's through telebehavioral health or otherwise. It helps. It's out there. And 2, let's talk about this idea of telehealth. Let's demand access this way. Let's demand healthcare kind of at our fingertips and use these resources and this technology that we have. Together we can transform healthcare. Thank you.